In this video, I will go over the lesions of the radial, ulnar, and the median nerve. So first, I would like to go over the path of the radial nerve. And the radial nerve wraps around the humerus and goes to the back of the hand and innervates this site. So its function is to extend the hand at the wrist. And what happens is that if there is a fracture of the mid-humerus, then there would be lesion of the radial nerve, as a consequence of which these patients will develop wrist drop, so they would not be able to extend the hand at the wrist. As for the median nerve, it goes over the supracondylar humerus and then goes through the carpal tunnel and then innervate this side of the hand. So if there is a fracture of the supracondylar humerus, these patients would not be able to flex the second and the third digits, as a consequence of which, once you ask them to make a fist, it would be like this. And this is referred to as Pope's blessing or hand of benediction. In addition, median nerve innervates the thenar eminence, so once there is a lesion of the supracondylar humerus, there would be a problem with the abduction of the thumb. So the thumb remains like this, and this is referred to as ape's hand. So ape's hand and the hand of benediction usually goes together. And then finally, we have the ulnar nerve, which passes over the medial epicondyle and goes innervate this side of the hand as well as the back side. So the function of the ulnar nerve is to help flex the hand at the wrist. And if there is a lesion of the medial epicondyle, these people will have weakness of flexion of the hand at the wrist, and it would be more like a radial deviation once they are flexing their hands. Now, so far I explained of the proximal lesions of the median and the ulnar nerve. Next, I would like to discuss the distal lesions of the ulnar and median nerve. So median nerve and ulnar nerve are innervating the lumbricals, which their function is to open the fingers like this. So if there is a lesion of the distal ulnar nerve, for instance, if there is a fracture of the hook of hamate, then these patients would not be able to open these two fingers. So once you ask them to open the hand, it would be like this. And this is referred to as ulnar claw. On the other hand, if there is a carpal tunnel syndrome, or if there is, for instance, fracture of the lunate, then the median nerve will have problems. So these two fingers will not open. So if you ask them to open the hand, it would be like this. And this is referred to as median claw. And that concludes our discussion.